Forbes Books presents Sustainable Leadership and Disruptive Growth with David Radlow. Transformation for a new and better world. Here's David.
Thanks for joining me once again for my talk with Dr. Vanila Singh, the Clinical Associate Professor at Stanford Medical School and patient advocate focused on clinical medicine, public health issues, pain management, and the opioid epidemic. Dr. Singh, staying on that subject of pain management, can we talk about alternative therapies? In the future, can you see folks getting reimbursed for something like acupuncture, physical therapy, or personal training?
So I don't call them alternate therapies. They are therapies. These are pain treatments. And the way we classified them in our task force report is in 5 categories. One is medications, not just opioids, but non-opioid options, neuropathic medicines that affect the nerves, muscle relaxants, things like acetaminophen, over-the-counter patches, gels, etc., that are made up of a lot of different compounds and a lot of different interesting things there. Then there's interventional procedures. Interventional procedures are non-surgical procedures that pain physicians do, which vary from injecting steroids into a joint to decrease the inflammation from degenerative arthritis or inflamed tendon. And steroids are very common because they are the most potent anti-inflammatory agents. There's also nerve blocks, where nowadays, if you can identify the target nerve that's the perpetrator, an abnormal nerve that was injured in surgery or that is scarred down and is overactive and causing highly challenging pain, or diabetic neuropathy, or anything that you could find as a target, you can block the nerve. And once you've identify that nerve as the culprit, there are a lot of things that one can do to that nerve, including ways to stun it into submission. And that's often needs to be repeated every few months or a year. And it's like radiofrequency ablation, cool ablation, even using Botox. Botulinum toxin has its very interesting medical use. We use it in chronic migraines and people who have some sorts of dystonia where their muscles are so stiff and they can't move it. And then you go to bigger procedures that are really the cutting edge of where we are in pain medicine right now. It's in the category of neuromodulation, and it's a fancy term, but what it is putting these interesting electrodes that stimulate the nerves, whether it's the spinal cord, for people who have problems there with their nerve roots, like that's the back issues with sciatica. Or again, people have neuropathies of their legs, and people who have very severe neuropathy understand this. I mean, I just had patients yesterday that I was talking to about this. You put electrodes, first there's a trial, and then if it's helpful, it's a non-pharmaceutical way. It's a small implant, and it basically alters the communication happening between the nerves that goes to the brain. And it's so cutting edge for these people who were resistant really to treatments, even medicines, and nothing was really doing the trick. And that's a lot of people, by the way, a lot of people who have this. And this kind of cutting edge innovation that's really made huge advancements in the last few years is making huge differences in patients with many chronic painful conditions. And you mentioned reimbursement. And reimbursement is something that is challenging. And, the insurance companies see, oh, well, we're paying a lot more for this. We're just going to cut it off or increase the criteria. And there's always those challenges. Then you go into complementary and integrative measures. So we talked about medicines, we talked about interventional procedures, and then complementary and integrative. So that would include things like acupuncture, which, by the way, we were successful in getting acupuncture covered for certain conditions, such as low back. So if you look in your benefits, a lot of plans now actually cover it. And, it may not be full, or, there might be a copay or whatever, but the point is that was never even on the list. Acupuncture has its value for some people, a subset of people, but not everybody. And it might be something that's part of that multimodal plan, like not just one treatment, but you need several things. Other things that come into complementary and integrative is even mindful meditation. A lot of times the challenge that patients have in addition to the pain is the coping and the very worry, because Dave, when you think about it, pain is a warning signal. If you get your hand in a flame of fire, before you can even think and recognize what's happening, your hand is already reflexively pulled away. Pain is a warning sign. When people have chronic pain, meaning endless pain that isn't addressed because of abnormalities in a variety of different conditions, it is a very distressing situation because you feel like there is something bad happening, and yet it doesn't go away. You can't remedy it so easily because it goes into disease processes of the nervous system, of the joints, of the bones, of so many different things. And so that's the challenge for these folks. And then, of course, many of them don't feel supported and they feel like people are just saying, hey, suck it up, because again, it's an invisible disease. So complementary integrative, we also talked about in that realm things like Reiki or Tai Chi. And these are things that have great value for people depending on what it is. But that often alone isn't the only thing that's going to do it, but it has an important role. The fourth category are something we call restorative therapies. And what comes to mind to people in that is things that help with functioning, improving your biomechanics. So that would be through physical therapy, which has such an important value. Sometimes people say, well, I did it and never helped. Physical therapy doesn't help in the traditional way of an immediate fix. It's the very important part of improving function and getting your biomechanics in order and doing it in a very directed, focused way. So it's not like just going to the gym and lifting weights or running on a treadmill. It's actually looking at the muscles that are weak and deconditioned and some that are overburdened. Because a person's been walking unusually or hasn't had their normal posture and it's been years. Or so to undo that and turn that ship is very important to getting to a better place, and it's highly useful, and I'm a big proponent of it. Other restorative therapies include aqua therapy, pool therapy. Warm pool therapy is like incredible, and it's not about swimming. People can walk in the water. Water offers resistance. It helps people. It's soothing. And then the fifth category is considering even surgeries. Those are, not usually in the realm of what primary care or pain specialist, but just knowing that if it's a nerve that's entrapped, there are a lot of surgeons who approach this very differently now. We work with some at Stanford in an interdisciplinary manner where, something comes to us or something comes to them and we kind of work together to help diagnose it. And then they do different types of surgeries to help address it. Those are some of the categories that we had laid out in our task force.
What about the basic healthy food? We've seen a lot of talk from the President's Commission on food is medicine, along with supplements and exercise. Would you be kind enough to comment on those three?
Yeah, absolutely. I mean, like that is a really big area and something that I certainly take very seriously. In fact, most of my patients get on supplements of some sorts. And when I talk about that, I mean the ones that have been shown in the scientific literature. So vitamin C, fish oil, alpha lipoic acid, L-carnitine transferase. Those are like four supplements that are utilized and really good for nerve health. And so when they have a neuropathic or radiating pain that comes from nerves or sciatic like pain, those are really important. Diabetic neuropathy, post-herpetic neuralgia, meaning people have shingles. And following shingles, some people develop this horrible ongoing pain. Just it's like in the dermatome, in that one dermatome where the shingles was, it's almost like many people want to like die. It's that bad, or trigeminal neuralgia and whatnot. So these are great supplements. We like to look at, there's others, there's turmeric, there's a lot of things that have really come into play. As far as food, understanding of nutrition and what you put in your body has really jumped. And I think it has such a huge role to play from the perspective of quelling the underlying disease, whether it's an inflammatory arthritis, or again, like I mentioned, lupus, or people who have gluten-related allergies and pain and inflammation. There's so much in that way of science, and having a good nutritionist that can help, especially when the diagnosis is known, that has great value. Those are the parts that the patients can really feel empowered in when they have the support, but they themselves are motivated to see it through. And I do want to say that the thing that I see that's really cool out there is like when people kind of take charge and they get involved. To me, that shows elements of hope. It shows that they're active in it. That I always feel the toughest scenarios and outcomes are really in those who are resigned to their fate. Sometimes that's because they're depressed, or they just feel like it's a passive approach that just fix me. And truly, there's no fixing. I mean, if you think about people who have high blood pressure, for example, when they make changes in their diet and they can diet control their blood pressure or diet control it with, say, lower doses of blood pressure medicines, it doesn't mean that the underlying issue is gone. It just means that you've addressed it with diet. Same with asthma. People who get asthma that's severe, they make lifestyle changes to help manage the asthma and quell it so they can live a closer, more normal life. And pain management is really the same thing. It's about making it so that your quality of life, your activities of daily living, your work, and things that you hold dear are compromised the least. That really helps get people to feeling empowered again. Psychology, by the way, was the other category I just realized did not get to, but it's really more like behavioral health. Our task force was way ahead of the curve. We had advocated for telehealth to improve access for people who live in different areas that don't have the resources of a Stanford will definitely benefit. So there's pain psychology, but there's also coping skills classes. There's catastrophizing. Catastrophizing is when people feel like they have something and it means it's like the end of the world. They're worried that this is, the pain is representing a hidden cancer or something that's missed. And, it's just everything is dark and and the worst outcome's going to be there. How to cope with these things are really part of the mix. It's vital. It doesn't mean it's in your head. It means that the challenges that come with such a horrible condition as chronic pain can be made better so that things don't spiral down.
It's a good segue on the business side of things. Last spring, you joined the advisory board of MindBloom, a leader in psychedelic therapy. Can you tell me more about the value proposition for psychedelic therapy and why you decided to get involved with MindBloom?
Sure. What was interesting to me is that, many companies were able to offer services at a time when it was really hard to get them during COVID. And what interested me about MindBloom is that they had developed these guidelines with experts that they had for offering ketamine, which is a controlled substance, and offering it to people who have recalcitrant depression. Now, these are people who have failed other measures to help with depression. And I always have a soft spot for our veterans. And I know we have vets who have had horrible, horrible depression because of what they've been through. And oftentimes, they're not getting better. The other thing that ketamine has been shown to possibly help with is PTSD. So I just wanted to provide my clinical perspective in this company for whatever it's worth. I'm obviously just an advisor, but it is interesting to me to continue to see these options for the people who are hurt the most. Depression has gone through the roof after the pandemic. Mental health, of course, is forefront as it should be. But if you look at an area that has had and needs greater advances, it's really mental health, it's depression, it's PTSD. And there is promise, there is scientific literature that's showing that many of these patients actually do get better. And the most important thing, however, is that they do have a clinician, a physician who they can go to, should things change, because you always have to be very careful with the patient population. But I'm excited, and I'm always thinking about what are what are promising strategies? And you have to look at it from a risk-benefit analysis. There are risks to, again, medicines that we've already talked about with opioids and potentially with ketamine and others. And ketamine's been around for a long time and is used in anesthesia, for example, changing wound burns in kids and adults. So these agents have been around for a long time, but if they have some use that might better serve a certain subpopulation where the risk benefit analysis makes sense, I'm all for that. I want to see us actually making headway clinically for people who are really in grave challenges.
You've spent the last 20 years at Stanford School of Medicine as a clinical associate professor, and you also serve as a teaching mentor at the Walter Reed National Military Medical Center. Why have you made teaching such a big part of your life?
Simply, I love it. I mean, to see up and coming young people, it's so exciting. I think medicine is and remains a noble field. It is a different industry. I mean, having gone in government and then being involved in some industry, you mentioned Mind Bloom, but there's a couple of others that I serve on the board of directors. And I feel it's really important to offer that clinical view when your feet are on the ground. I'm not an MD who is an administrator and 20 years out of practice. I'm in practice. And I think that perspective is really important. I like to share the experiences I've had with whether they're medical students, and I mean, these are brilliant fellows and residents who are eager and want to do something, and share how important it is to, as in years past, doctors were just busy doing their work because it's a very, very challenging, demanding profession. But to me, I realized years ago that it was more important that we also get involved with policy making, because policies were being made that made no sense, that were detrimental, in my view, to the health of the patients, that did not put the priorities or the resources where they should have been. And I want to share that with those kids. I love to teach about my specialties in pain, and if I can inspire someone to go into it, I love it. I mean, I have a couple of folks right now that I'm writing letters of recommendations for, and I hope I have felt inspired by our work together. To me, that's just kind of what it's all about, is not only taking care of patients, but really ensuring that the next generation, who are going to actually take care of me, but I mean, going to take care of everyone else, are there and feel the desire to be involved, because you can't really have industry in a silo. They need to have not just an MD, but a clinically practicing MD who understands what's going on. They need to hear that perspective, whether or not they want to. And I really believe when they hear it, the product is likely to be better, more practical, and something that's actually used, rather than a hot potato that's sold from one company to another, but really actually never realizes an impact in medicine. And I think the same goes for government.
What's the number one piece of advice you would give to anyone to accomplish the extraordinary things that you've done?
Without a doubt, I would say do not be afraid to go against the herd. Never compromise your principles, your beliefs. Hard work cannot be overestimated. No matter what people are saying nowadays, I think it is gratifying, and there's nothing better than being the real deal. And I think that's really succinctly what I would say.
What's next for Vanila Singh? Another run for Congress? More board roles? Or looking simply to make another huge difference in the world?
Well, Dave, you're so kind. I am open always. I love sometimes the unknown, because I've learned that when I've thought I was going somewhere, opportunities came in ways that I could never have dreamed. And I'm always wanting to help our country, the world over, when it has value to share our amazing knowledge here. But I love the people in general, and I find that I get back as much as I give, maybe more, because I'm very inspired by people who have huge challenges and show up in my office or on telemedicine with a smile. And so I just feel blessed, but I want to share it. And I'm always striving to do that. So I can tell you I'll be doing something. What it is exactly, what shape it takes in the next few years, I'm open.
Just one more thing before you go. I understand that you've done some work recently on the long-term effects on COVID. Would you be kind enough to explain that to our listeners?
COVID has been obviously in the news for the last couple of years, and now we're really seeing that long COVID, which is people who've had long-term consequences of COVID, are also having, when it relates to pain, painful conditions. And the most common complaint is widespread pain, which is often accompanied by fatigue, sleep issues, maybe even respiratory issues. If some of your listeners have heard of Guillain-Barré, that's a post-viral syndrome where it affects the muscles. Well, it's not unlike that concept where from the coronavirus, unfortunately, there's some percentage of people who do develop this sort of widespread pain that stays with them. Since this is also new, it'll be interesting to see how long. For some people, they do recover, but for others, we're seeing that it's ongoing. And again, it can be diffuse muscle and joint pain. Some people have headaches, and some people may even have some type of nerve pain or neuropathic pain. And, it's really important to bring this to the attention of your doctors, to address some of the comorbid depression and anxiety, which also we're seeing in patients who've had COVID, and use a multimodal approach where it could be some medicines, steroids, maybe antibiotics, physical therapy, acupuncture, like we were talking about earlier, and measures to help address depression and anxiety. There may be some interventional procedures as well that might be beneficial. So it is there. It's unfortunate, but the reason I'm talking about it is because it's really good just to know and to go and check with your doctor so that you can get help if this is in fact the case.
Thank you for that. Where should people go to get more information on Vanila Singh and to learn more about pain management in the illicit opioid epidemic and what is being done to help people?
Thank you. You can go to my website, vanilasingh.com. I'm also on Twitter at Vanila Singh, just starting on Instagram. I have a LinkedIn page too, which is just my name. Most of those have a link to the Best Practices Pain Management Task Force, which I think is a blueprint for anyone who is, whether you're a patient advocacy organization, you're a medical organization, a health system, an independent practitioner, or just one singular patient. Everything is there, and it's really intended for you to use to your benefit. And so I hope you enjoy that and maybe see you on TV sometime.
Thank you so much. We've really enjoyed it. I myself will say that I really learned an awful lot, and I can't thank you enough, and I know our listeners will as well.
Thank you, Dave. It was a pleasure to be on your show.
To connect with David, go to davidradlow.com. David's book set, The Principles of Cartel Disruption and Secret Stories of Leadership, Growth, and Innovation, are available wherever books are sold. This has been Sustainable Leadership and Disruptive Growth with David Radlow, a presentation of Forbes Books.